The coronavirus COVID-19 outbreak is currently sweeping the world. At the time of writing, the pandemic has recorded over 180,000 cases, with over 7,000 deaths globally. China remains the worst-hit country with more than 80,000 cases, while Italy trots behind for the second spot with close to 28,000 cases. While most of the nations in the world are struggling to maintain a collective response to the novel coronavirus, Japan is battling the disease in quite a disciplined fashion. So far, the country has registered 895 COVID-19 cases, out of which 144 have recovered, with 27 fatalities on record. This makes the Japanese response to coronavirus one of the more controlled situations on the disease's map. According to the World Health Organization, the first case of the novel coronavirus in Japan was recorded on January 16th of 2020. It was from a person who had traveled from Wuhan, China, the epicenter of the outbreak. Less than a week later, community spread in the country was confirmed, with more cases coming to the forefront. Unlike many other countries, the Japanese response to coronavirus was swift. Much of it was due to the Summer Olympics 2020 that are scheduled to be held in Tokyo. In preparation for the Olympics, the country was already doubling down on vaccinations in preparation of the big games, which then turned into COVID-19 prevention efforts. The unfortunate segue allowed Japan to maximize its efforts and allocate resources towards controlling the viral outbreak with the form of special committees and advisory boards. At the center of these efforts was the unfortunate Diamond Princess, a cruise ship that held a significant number of suspected COVID-19 cases after being exposed to a traveler who tested positive in Hong Kong. On February 4, 2020, the Diamond Princess was quarantined at the Japanese port of Yokohama, carrying around 3,700 passengers on board. When the quarantine ended on the ship on February 19th, the passengers were placed in quarantine on land, with 700 more cases testing positive for COVID-19. Apart from the Diamond Princess quarantine, Japan took additional efforts to curb down the novel coronavirus outbreak on its land. This included imposing stringent travel restrictions towards areas that had shown large cases of COVID-19, such as China and South Korea. In addition to that, the country also moved forward with rolling out national insurance to cover for COVID-19 testing. It also lowered the previous threshold in regard to prescribed tests, with doctors being able to determine whether a patient needed COVID-19 testing as opposed to public health centers making that decision for them. The Japanese government also rolled out requests to restrict mass gatherings and closed schools in late February. It then announced two multi-billion-dollar relief packages to help the economy grapple with the effects of these decisions, such as providing financial aid to affected businesses, as well as families that needed to care for children staying back from school. A third of these relief packages is still in the works, but hasn't yet been announced. By March 15, 2020, the Japanese response to coronavirus came into full force when the country banned entry for visitors from affected regions of China, South Korea, Iran, and Italy. It also toughened up its screening processes over airports. At the time of writing, the Japanese legislative branch has revised a 2013 law that gives the Prime Minister Shinzo Abe the power to declare a state of emergency if there's a need for it. These efforts have put the disciplined culture of Japan at the forefront of controlling the COVID-19 outbreak, even though any plans to cancel the Summer Olympics have still not been announced.